Assalamualaikum and hi Puan Hartini and friends. My name is SYAZAA. Today my group and I will introduce you guys our poster about Tyrosinemia type 1. This poster is prepared by me, ALMAS, MASHITAH, ELMA and SYAFFI. So, I will start with our title. It is a broken pathway toxic build-up. Tyrosinemia type 1. Have you ever wondered what happens when the body cannot properly break down an amino acid? Tyrosinemia is a group of rare inherited metabolic disorder that occur when the normal pathway for breaking down the amino acid tyrosine is disrupted. When this metabolic pathway is broken, harmful toxic substances begin to accumulate in the body. Over time, this toxin can cause serious damage to vital organs, particularly the liver, kidneys, and nervous system. Why we choose type 1? It is because among the different types, Tyrosinemia type 1 is the most severe form. It is caused by a deficiency of an important enzyme known as fumarylate acetoacetate hydrolase or FAH. This condition is rare, affecting approximately 1 in 100,000 live births worldwide, but its impact can be life-threatening if not treated early. In this poster, we will focus on Tyrosinemia type 1, including its key features, symptoms, and how it can be managed effectively.
For symptoms, Tyrosinemia type 1 usually present in two main forms, which are acute and chronic. It depends on age and disease progression. First, the acute form usually appears in infancy. Babies may experience persistent vomiting, diarrhea, and fever, which lead to failure to thrive, meaning they do not gain weight or grow as expected. Many infants also develop jaundice when the skin and eyes turn yellow due to liver dysfunction. Another serious symptom is coagulopathy, or we call it as abnormal blood clotting, which can cause easy bruising and bleeding. This symptom can severely damage the liver at an early age. Next, the chronic form, which typically develop after 6 months of age if the condition is untreated or poorly controlled. Children may develop progressive liver disease, leading to liver cirrhosis and increased risk of hepatocellular carcinoma, which are a liver cancer. The kidney also be affected, causing renal Fanconi syndrome, where essential nutrients are lost in the urine. In addition, patients may experience neurologic crises, which can include severe pain, weaknesses, and paralysis. Over time, developmental delay may occur due to ongoing organ damage and metabolic imbalance. In summary, the symptoms of Tyrosinemia type 1 are severe and progressive, mainly affecting liver, kidneys, and nervous systems, and without early treatment, the disease can be life-threatening.
There are some treatments available, such as medication. Nitisinone is a recommended medication and must be continued without interruption once individual had diagnosed to have Tyrosinemia type 1. Nitisinone is very essential due to its ability to prevent the body from producing toxic chemicals that would otherwise destroy the liver and kidneys. Hence, once the patients delay consuming nitisinone, it will affect and lead to health problems such as liver failure or hepatic malignant change. The main function of nitisinone is basically to keep the succinyl acetone at zero. Next is diet. Alongside nitisinone medications, patients also have to follow a strict low-protein diet, such as avoiding consuming meats, egg, or cheese to ensure the tyrosine level from getting too high. If the tyrosine level rises, it will cause serious damage to eye and cognitive function that will lead to learning difficulties. Since the phenylalanine will convert to tyrosine, the patients also are advised to consume phenylalanine and tyrosine-free amino acid supplement, since our body still needs protein even only in small amount. Liver transplant only takes place when babies may need emergency liver transplantation if they fail to respond to nitisinone or acute liver failure. Liver transplant able to cure the metabolic defect in the liver, but it is a major trade-off since it could lead to surgical risk, and the patient must take immunosuppressant forever so the body doesn't reject the new liver. Yet, consuming drugs also could lead to some complication afterward. Last but not least, intervention for gene therapy is the most suitable future treatment to cure tyrosinemia type 1 due to its ability to confer a selective growth to corrected cell, lowering the initial transduction threshold for phenotypic relevance. Initial transduction targets in tyrosinemia type 1 could be substantially less, while ultimately generating complete correction of the liver. It means that doctors only need to successfully fix a tiny amount of a liver cell to generate a healthy cell entirely in the liver, since the healthy cells are stronger, they live longer and multiply. As the sick cell die off, the healthy cell grow into the empty spaces.
Tyrosinemia 1 is caused by mutation in the FAH gene, which is located on chromosome 15. This gene codes for an enzyme called fumarate acetate hydrolase, or FAH, that is essential for breaking down the amino acid tyrosine in our bodies. Normally, tyrosine comes from the food we eat and the body processes it into a harmless substance. But in tyrosinemia 1, mutation disrupts this process. Now let's talk about the type of defect. The most common issue is a point mutation, where a single nucleotide change in the FAH gene that messes with the RNA splicing, meaning the gene instruction gets jumbled during protein production. This is especially prevalent in certain populations. There are also other defects like deletion, where parts of the gene are missing, or insertion where extra bits are added. All of this leads to a faulty or missing FAH enzyme. So, how does this gene break cause the disease? Well, the mutation altered FAH enzyme structure and function. Remember, FAH job is to break down a toxic intermediate called fumarate acetate, or FAA, into a safe byproducts that body can extrude. When FAH is defective, it cannot do this properly. So FA and other metabolic byproducts start building up in tissues and organs. What fails inside the body as a result? That toxic accumulation hit the liver and kidney hardest. In the liver, it causes cell death, scarring known as cirrhosis, and eventually liver failure. The kidneys suffer from renal tubular dysfunction, impairing their ability to filter waste. Beyond that, the buildup can affect the nervous system, stunt growth, and even raise the risk of liver cancer if not treated early. It's a domino effect where one broken gene leads to a widespread damage.
Okay, so there are several diagnoses that can be done to determine whether the person have the tyrosinemia type 1 or not. So the first test that can be done is the molecular genetic testing. So basically, molecular genetic testing divided by two tests. The first test is the single gene testing, and the second test is the comprehensive genomic testing. So for the first test, a sample of the patient's DNA, which is blood, is taken, and then the sample will be collected and be sent to the specialized lab to measure the quantity of the FAH. Okay, for the second test, which is the single genomic testing, the tissue or the biopsy or the blood from the patient is collected, and then the DNA or RNA is being amplified and extracted
by the next generation sequencing, or we can call it as the NGS technology. And then the sample from the tissue or the blood is being compared to the reference so that we can compare whether the sample have differences or not. So basically, if there's differences between the reference and sample, we can conclude that the person have the tyrosinemia type 1. So the next diagnosis that can be taken to determine whether we have the tyrosinemia type 1 or not is by newborn screening. So the dried blood spot is collected after 24 and 72 hours after giving birth. So basically, this is important to measure the quantity of the succinate acetone in the blood. And then tyrosine concentration also be measured to confirm the quantity of the plasma membrane or the urinary succinate acetone. Okay, the last diagnosis that can be done to determine whether you have the tyrosinemia type 1 or not is by the urine test. So basically, a sample of a clean urine is collected, and then the sample is being brought to the specialized lab to quantify the level of the succinate acetone in the urine.
List of reference can be found by scanning this QR code. In conclusion, although tyrosinemia type 1 is a rare and life-threatening disorder, early detection and proper treatment can greatly improve quality of life. With advance in screening, medication and long-term care, affected children have increasing hope for healthier and longer lives. That's all from us. Thank you.